the inside story on the issues that affect you and your community. This is Local 12 Newsmakers.
Good morning and welcome to Local 12 Newsmakers. I'm Dan Hurley. 6 weeks ago, I had several guests who talked about a workforce development initiative that started in Leadership Action, a program of the Cincinnati USA Regional Chamber, a program that I manage. That effort, designed in conjunction with the Cincinnati Public Schools, is designed to help high school students gain a better understanding of career opportunities, especially those that do not require four-year degrees. This morning we're going to take a look at a second initiative also out of Leadership Action. This one grew out of an initiative or an interest in helping adults, not students, and it is called Prosperity for All. This morning I am joined by the team leader of that particular initiative, Prosperity for All, and it's Matt Flege, who is the head, works at last 8 years at St. Vincent de Paul here in Cincinnati, is currently the manager of strategic initiatives. Matt started his own work experience as a Peace Corps volunteer and is about to embark on doctoral studies in public policy at Clemson University in South Carolina. So you're leaving, and that means either we failed or you'll come back, I hope.
Do the second round of boomerang. Dan.
Yeah, the whole goal is to get people like you, talented people, to stay in Cincinnati. But sometimes you got to go off, and then maybe you come back. So, Matt, this project on workforce as well isn't looking so much at the long pipeline. It's looking at people who really need jobs, who ought to be in the workforce, but they're not there. Particularly, what group of people are you looking at?
So, Dan, we're really looking at low-income parents who probably have a limited education, maybe a high school diploma or maybe not even a high school diploma, somewhat limited work history, but who want to provide for their children, but with their education and work experience, the only jobs accessible to them are minimum wage, part-time work that isn't going to be enough to support their families.
Well, you know, some people would say, why not take those jobs and build on them, and over time, you raise yourself up?
Sure, absolutely. You know, most people say, well, just get a job, but at $8.10 an hour, 20 to 25 hours a week and no benefits, that's not enough income to support your family. So actually many workers still rely on public benefits, food stamps, Medicaid for health insurance, in order to get by. So an entry-level job for a single mom raising kids isn't going to be enough to meet their needs.
And people who are on public assistance in the post-welfare reform, which is now pretty old, they do have a work component. In order to receive assistance, they have to do some kind of work. So what's that? I mean, I think most of us probably wouldn't even realize that's going on.
Sure. So welfare reform took place in the mid-90s, right, but there are still a lot of misconceptions about what it is and what it isn't. So actually, I'd really like to try to break that down a little bit. First of all, I think some people still have this conception of the welfare queen driving a Cadillac, receiving these generous government benefits. Welfare in Ohio, the program is called Ohio Works First. It is a 3-year program, so you can only receive the assistance for 3 years. It's very limited financial assistance. For a single mom with 2 kids, the assistance amount would be $465 per month. So obviously not going to be driving a Cadillac at that dollar amount. And thirdly, and this is a real surprise to a lot of people, there's a 20 to 30 hour per week work requirement. So each person, in order to continue receiving that $465 per month, must either volunteer or work for 20 to 30 hours per week, depending on the age of their children. There are some things that count for that work requirement, some things that don't. Community service, so they could come volunteer at a local thrift store for 30 hours a week, that counts. Minimum wage work, that would count. neither of those, though, really lead towards a living wage job. Education, so getting your GED or completing a vocational education certificate, only counts in very limited circumstances, maybe 10 out of the 30 hours a week, and maybe for only 1 year out of the 3 year. So our goal is to change the rules around that work requirement to allow people to pursue their education and really obtain a living wage job so that they can actually reduce their reliance on benefits.
So part of it is allowing more time in that 30 hours for education to go wherever you are to whatever the next level is. What's the problem with that? Why, does this require a legal change? Does this require, what's required to allow that to happen?
Sure. So when we first had the idea for this project, it really came out of that common sense idea of let people pursue their education to get a better job. So we said, is this possible? We found 2 states, Minnesota and Nebraska, that had been able to change their rules. So we thought we would investigate making this change in Ohio. The problem is the workforce requirements, they're actually federal rules, again, established in the mid-90s as a part of welfare reform. And in fairness to the Congress of the mid-90s, that was a much more robust economy with more entry-level jobs. So at that time, it might have made more sense to just go get a job. So because they're federal guidelines, in order for Ohio to continue to provide the benefit to its residents, at least half of the participants need to meet those federal work guidelines. And currently, it's about 50-point-something% that are meeting the guidelines. And if the state dips below that 50% participation rate, we would lose all of that federal money. So unfortunately, a statewide legislative change that we had initially envisioned was not possible. But we were told by staff in the governor's office that Hamilton County is ahead of the curve. Hamilton County Job and Family Service has the highest participation rate in the state, and they'd be willing to maybe try out a pilot project here locally.
And that's what you've designed?
Yes.
One of your project members, one of the team members, is in this workforce area for Cincinnati State, and you've identified some very definite things that people could pursue and still fulfill their work requirements. Talk about some of the things that were identified.
Sure. So what our pilot project will consist of is 10 recipients of Ohio Works First. So again, single parents. 10 current recipients and 10 former recipients, so 20 people total. What they'll do is they'll have an intensive case manager who will help them out with some life skills development. Then they will be enrolled in one of 4 educational areas: pharmacy technician, phlebotomy, advanced manufacturing, or IT. Most of these are at Cincinnati State. One of the programs is at the CityLink Center. But these are relatively short-term certificate programs, 10 to 16 months, and they have 95% job placement rates on the other end.
10 to 16 months?
Sorry, 10 to 16 weeks.
That's
yes.
what I thought.
Thanks.
Yeah, otherwise that becomes pretty long for people in that situation.
So about 10 to 16 week programs, 95% job placement rates, and the jobs start at around $12 per hour. So certainly well above the minimum wage threshold that most of the participants are going to be used to.
Okay, so these are jobs that pay higher in the initial wage. Do they have any sort of career ladder once you're in them? If you become a pharmacy tech, are you stuck there forever, or is there a way to build on that and actually then use that as a foundation stone?
Great question. So the manufacturing and IT programs definitely offer direct pipelines for continued growth. With phlebotomy and pharmacy tech, many of the people we interviewed that are current participants express an interest in healthcare, specifically in nursing. Nursing is a long educational program to become a registered nurse, but we feel that the pharmacy tech and phlebotomy offers a good way to get your foot in the door to the healthcare field, gain some initial experience, make decent money while you pursue a longer-term goal. It might not be in that specific field, but through another field like nursing.
So it gets you into this this broader field, which is really growing. I mean, healthcare
Absolutely.
is a booming area, so there's at least a possibility you've got a technical basis that you can build on.
Right, it's a great first stepping stone.
So where do we stand with implementing this program?
Sure. So we have permission from the state and the county to do the pilot. We have partnered with Easter Seals Tri-State to host a case manager for the pilot. But right now we're in the fundraising phase. Big expense for this pilot will be providing a case manager. Most OWF participants, their case manager has a caseload of 200 to 300 families, so obviously not very much support there. We wanted to have one case manager for our 20 participants to make sure they get the support that they need. So we are about halfway to our fundraising goal to get the program started, and we're trying to wrap up the rest of the fundraising this summer so that we can start the pilot in the fall. So
the 10 to 20, the 20 people who will be selected, what will be the criteria? What will people... Is this self-selection? You say, this is an option, I'll volunteer for this. What are you looking for in the people who will be participating?
You know, we've asked Hamilton County to give us sort of a good representation of the population that receives these benefits. We didn't necessarily want to cherry pick and say, give us your 20 most highly motivated best candidates, because we really are looking in the long run to demonstrate some results for eventual policy change. So we've asked them to give us a good representation. About a third will not have a high school diploma, so they'll need to start with completing their GED.
Which has become a lot more difficult.
It has become a lot more difficult, and that's where some of the other supports that we're putting in place for people in the pilot will be important.
Yeah. So a third will have to work on GED.
The remaining 2/3 will go right into one of the certificate programs.
And what about the cost of this to the people who enter the program?
There'll be no cost to any of the participants. All of the certificate programs are eligible for different subsidies that are available for people for career training. We really looked at this pilot as, you know, there's great job training programs in Cincinnati. Mm-hmm. There's many open jobs in Cincinnati. And there's people who want to fill those jobs, but there's so many barriers to really pursuing your education while raising a family that we looked at this pilot as a way to sort of connect those dots, connect willing work participants with an educational and training program, and eventually with the employers.
One final thing. You've alluded to this, you've talked about it a little bit. You've dealt with Columbus a lot on this whole thing. What have you learned? What have you learned about dealing with the political world, not just, I mean, you come out of the social work background, you're dealing up there with policy, with State House, with the governor's office. What have you learned?
I'd say two big takeaways, Dan. You know, first of all, one is that just because everybody thinks an idea is a good idea doesn't mean it can happen. We haven't talked to a single state representative or representative of the governor's office who have thought, no, these people shouldn't pursue their education. Yet, because of some of the federal restrictions, it's not necessarily doable in the short term. The other big lesson, though, is that, you know, when you set a goal, our goal was connect people with education and jobs. You can't necessarily be stuck with the method to getting there. We thought we'd be going to Columbus, drafting some legislation and making a change. That hasn't quite panned out, so we've had to pivot. So now we're looking at a pilot. How can we help these 20 people and set the stage for the long term? So I think as long as you stick to what your original goal was, have some flexibility, you'll be more likely to make change happen.
Well, Matt, thank you very much for all the work you do through St. Vincent de Paul, the great leadership in this particular project, and good luck at Clemson with your PhD. And I really am sincere when I say I hope you come back here. We need people like you. Stay tuned. After the break, a new report on the state of the region's travel and tourism industry and its influence on the regional economy. Welcome back. When it comes to attracting visitors, the Cincinnati region has been investing in developing assets to draw tourists as well as convention goers. In addition to specific events or facilities, the region has developed an unusual marketing model, On the one hand, the local convention and visitor bureaus, the Cincinnati USA Convention and Visitor Bureau and Meet Northern Kentucky, focus on driving convention and meeting sales. The Regional Tourism Network, on the other hand, focuses on marketing to leisure travelers. In addition, all three organizations collaborate regionally. The travel and tourism industry issued its annual report, Impact and Momentum, last week, and the news is good. To discuss this report, I am joined by Linda Antus, the President and CEO of the Regional Tourism Network, and Eric Summe, the CEO of Meet Northern Kentucky. Welcome to Newsmakers.
Wonderful to meet you.
Thank you. It's good to have both of you here. And one of the things that I was pointing attention to was the fact that we actually have regional collaboration around this particular set of opportunities. And in your report, you say it's unique. I am very cautious about ever saying anything is unique, so I changed that to unusual in my script. But you want to talk about that a little bit, what that means in terms of collaboration and closing that wide river?
Absolutely. Well, if you really think about our region, the Bureau of Labor Statistics measures us as 3 states, 15 counties. So we truly are regional. When you think about the travel and tourism business, you think about someone who's coming on business or someone who's coming to have a good time for leisure. They aren't going to think of a river dividing or state lines dividing. So the opportunity, because of the richness of the experiences in our region, was to create a regional model that enabled us to target leisure visitors across those state and political lines. There's no one else in our industry, in this country, that is doing the business this way.
You're sure about that? Just cautious about that word. Eric, you're from Northern Kentucky.
Correct.
Sometimes Northern Kentucky, and I'm from Northern Kentucky, sometimes Northern Kentucky is sort of added on, but not a full partner. Full partner in this situation?
Yes, it is a full partner, but there's a context to it. I mean, obviously Northern Kentucky goes as Cincinnati goes. You know, we're part of the region, and so for us to look at it any other way, in my view, would be short-sighted. As a destination, we have a full array of assets and experiences, but part of our assets are in Cincinnati. So we benefit from that. A stat that I like to use is that when you look in the state of Kentucky, the 3 biggest destination areas are Louisville, Lexington, and Northern Kentucky. Because of our proximity and our regional approach to the visitor and collaboration, 1/5 of the tourism expenditures in the state of Kentucky are in Northern Kentucky. And Cincinnati, obviously, is one of the reasons behind it.
Okay, so it really does work here.
It does work.
It really does. And I want to take a look at some of the numbers that you were able to generate in this report, and particularly the ones about economic impact and whatever. So if you look at it in this recent report, you found 24.1 million visitors who spent $4.4 billion. And these are 2013 numbers, am I correct? Okay. And that sustains more than 74,000 jobs. I have a question about that, but let me just finish these off. And generates $482 million in state and local tax revenues, which helps offset about $600 per household for local people because of these kinds of outside spending that comes in. When we say 74,000 jobs, you're not saying 74,000 jobs that exist solely because of this industry, or is it partially supported by this? That's a big number, 74,000.
It is a big number. If you think about it, it's easy to describe the fact that 74,000 jobs are those that are sustained by the tourism industry. A large portion of those are direct. For instance, 100% of the hotel business would be 100% of those jobs. But there are flow-through or ripple effect jobs because the people who create the materials and all of the things that support the tourism industry doing its business are also the people who work and are counted in that number.
You know, I have some video of one of the new hotels in downtown Cincinnati that is just open in the old Enquirer building. It's actually 2 hotels. And Eric, I'm going to direct this at you, even though this is a facility in downtown Cincinnati. I know there's hotel planning going on in northern Kentucky as well. True. There's a lot of new hotels that have come online.
Absolutely.
Are they justified? Is the market I mean, this is private spending, but it's hard for me to understand all these new hotel rooms.
Yeah. Well, the process as new hotel development comes our way is that there are a number of hotel developers out there, and they're looking to acquire properties, they're looking to sell properties, they're looking to build properties. And the process is they will normally contact us, and we'll provide them overall destination information, but they do their own analysis. So, you know, when we see someone interested, you know, we parallel our efforts with them to make sure they have all the data they need to make the decision. But ultimately, the developer says, this will work, this brand will work, or in the case of the Enquirer building, these 2 brands will work.
These 2 brands, which is really an interesting approach.
And so, you know, it's a leap of faith for us because we figure they've done their homework and they know what the trends are, and so you see it, the growth on the Cincinnati side, and we have 2 hotels that are being built in northern Kentucky.
And one of those is in Newport, right near the aquarium, or near the
right adjacent to Newport on the Levee, the former surface lot,
right
across from the Hoffer House. It's a loft, is the brand, and then of course on 7th and Madison and Covington, they're renovating the old Coppins building,
which was City Hall.
Which was City Hall.
Coppins department store, for those of you who didn't grow up in northern Kentucky. Eric and I got all of our clothes there.
Yes.
Honestly.
Yes, that is true. And but now it is, and then City Hall, as you said, and now it's becoming a wedding boutique hotel called Hotel Covington, and it's scheduled to open late spring of 2016.
On the Cincinnati side, is a lot of this being driven by the casino? Is a lot of this being driven by increased convention traffic? I mean, again, it fascinates me.
It's a wonderful problem to have or question to ask, and it's being driven by the need for and the desire for differentiation. What's really critical in answer to your question is that these are all very different experiences from each other and from what we already have here as hotel supply. And that's a key to growth because lodging and food and beverage are 2 of the strongest drivers.
You know, one of the things that's fascinating to me, another set of data points in this report, is the growth in recent years, and especially against the economic downturn period.
Correct.
I mean, we're looking at pretty amazing growth, right?
We are.
Eric?
Yeah.
Or
well, we are, and you know, I came into this position in 2011. And as we track the metrics for growth from the 2008-2009 recession era, we've had every one of our indicators have grown month by month, year by year since that time. So the conclusion is, yes, it's coming back, and it's coming back stronger than ever.
And it's coming back in many ways with a larger share of growth than other markets comparable to us. For instance, typical sustaining growth is 3%. We were growing at 4.1% per year since 2009. That's phenomenal.
And 2014 over 2013, 5%.
You bet.
Which is very, very strong. So a lot of this, and one of the reasons I started with luminosity is because it's in over the Rhine, because it's something that's using traditional assets that we have, but in a new way.
Yes.
And is drawing people in. I mean, it's just incredibly popular, drawing people from a lot of places. What do you say is in the future? What do we have to do to keep this going in the future?
It's an excellent question. We know that we do need to continue to develop. We need to stay close to our visitors. We do lots and lots of research annually as well as nationally with studies like this. We need to stay close to how the millennials have different interests from our generation.
Those millennials, I'm just about out of time.
But we need to keep our ear to the ground and our eyes on the visitors and listen to what they want and keep developing.
Eric, in 15 seconds, is there anything that you want to add to that?
I will just say that certainly yes to that, but the experiences now, drive it more than ever. They're looking for an experience, not just to stay in a place.
Okay, experiences, and that's those millennials. Okay, thank you very much. Thank you for all your work. Thank you for making Newsmakers a part of your Sunday morning. Join us again next week to meet the men and the women working to make our region a better place to live and to visit. Have a good week.